Hi everyone, thanks for joining us. I'm here with Dr. Therese Lango, an interventional cardiologist at North Alabama Cardiology, right here at North Alabama Medical Center. February is Heart Month, so we asked our community what you wanted to know for this segment of Ask a Cardiologist. So Dr. Lango, with COVID still very prevalent in our community, is the hospital safe to come to? And should people keep their regular doctor's appointments, or is that something that they should be rescheduling?
Well, first off, if you need to come to the hospital, it's time. Okay, playing around or delaying may delay and affect your long-term outcome. So yes, the hospital is working very hard at keeping things safe. And I think we've done a really good job with that. So I really think it is safe. And if you need the hospital, you need the hospital. You don't need to wait. One of the things that has happened with the COVID is that many people have delayed, and it has had very detrimental results in the population. As regards going to the office, most offices have multiple options for patients. At least some of that can be done through telemedicine, which has become something we do on a regular basis. However, that's not every single time, and your offices are being managed in a similar fashion. We're aware social distancing, keeping things clean. I can speak for my office especially. We're very careful. Rooms are wiped completely, equipment changed every single time for patients. So yeah, I think it's really important to keep your doctor's appointments in one form or another.
Right. Instead of getting worse before you can get care.
Correct.
And I think you guys have seen that. People coming to the hospital sicker than they ever are during this time period. Talk a little bit about that.
Patients delaying because of fear of the virus often ends up with them coming in a more complicated state where things have become more urgent, and it becomes more difficult to treat them effectively. And that's one of the things that we've been fighting through this. When you arrive more ill with more complications, it becomes something that takes a greater burden to the healthcare system to take care of. And although we still do that very effectively, the bottom line is oftentimes there are longer repercussions for the patient long term.
And I know we can't choose our family, but how much of an impact does family history have on our heart health?
Well, as I often tell my patients, the one factor we can't change, or one of the factors we can't change, are your family history. You can't trade in your parents. Right. So you get the genes you get, and it behooves us to try to modify all the risk factors we can modify. Those risk factors include sedentary lifestyle. Are you eating well? Do you smoke? Are you taking your medications in accordance with how you're supposed to take them? Those are the things we can change. Can't change the fact that we're getting older. We can't change the fact that you're male or female and your risks associated with that. And you really, again, cannot change your genetics, but you can fight them. How about that?
That's right. And talk a little bit about that. How can you fight them?
Well, oftentimes it's really controlling those risk factors. If you have a family history of premature coronary disease or vascular disease or stroke, attention from the get-go for risk factors which are modifiable, such as what's your cholesterol, what's your blood pressure, are you eating a healthy diet, not a fad diet? Are you maintaining activity even in this kind of a situation where oftentimes people can't go to the gym? You can find lots of things to do at home. Walk in your neighborhood when the weather's okay. Walk in your own home. 5 minutes every hour that you're awake. Get up out of that chair and move around. Those are the things you can change. Really important is if your physician says you need this medication or you need a medication, it's important to be compliant with it and not miss doses of the pills. And sometimes that's hard, okay? But if we don't control those things like blood pressure, like blood sugar, like cholesterol, we're fighting against the things that we could potentially modify and give you a better outcome.
Right. So you might as well do what you need to do to have a better outcome.
Yes.
Right.
And that's really what the goal is. The goal really is prevention, keeping you out of the clutches of people like me on a regular basis.
Right. And what are some of those symptoms of heart disease? Some of the typical symptoms, and then some things we might not really think about that goes along with heart disease.
The typical symptoms that you hear about when someone's having a heart attack is chest pain, heaviness, tightness associated with shortness of breath. Maybe you get sweaty, maybe you get nauseated. The other thing I think that people don't often think about is the decrease in their exercise tolerance. Now, I'm not talking about you ran the Boston Marathon last year and now you can't. I'm talking about the fact that you climbed those stairs and gradually, over a short period of time, that's changed. Things that you do typically. I made the bed. I usually clean the kitchen. I'm able to clean an entire room without having to sit down. But now I really have to stop. Those are often indicators for patients that there is something changing that they need to bring to the attention of their physician to act on before it acts on them, before they develop the chest pain. Also be aware of the fact that women don't always have those symptoms, or they have them, but let's face it, we like to ignore things because we've got things to get done.
Yes.
We've got a house to take care of and a family to take care of, and oftentimes they will let it go much longer. Women also tend to have more GI kind of problems. When I say that, I mean sometimes they'll have a lot more indigestion or things that they interpret as indigestion. It's also very common for people as they age to say, well, it's just because I'm getting older. So we are living longer, and if we take care of ourselves, we're living quality. Okay, these are people that are busy and active and have their brains are working. They may not run that Boston Marathon, but they stay active in their home. So it's very important to not attribute everything to, oh, I'm getting older,
Exactly.
and therefore this is just how that is.
And pay attention when you see a change or notice that.
Or if your family notices it, because oftentimes your family, either your spouse or your children or your friends, will say, something's changed, and they may notice it before you do. So
take those symptoms,
those hints.
And go to your cardiologist
Yes.
at that point, right?
Talk to your doctor. Tell them what's going on. Let us help you sort out what's happening. Okay. I think that some of the things that we ought to think about in terms of women and heart disease is that over the last 30 years, the prevalence and incidence of heart disease and the outcomes have improved steadily until about the last 10 years. This is not so true for women. We've reached a stagnation point where things aren't getting better. And things aren't getting better because we're not getting quick enough to the hospital. Again, it has always been something that since the initiative in 2004 was launched from the American Heart Association, they talk about the fact that women tend to present between 5 and 8 hours later into an acute event than their male counterparts because, again, got other things to do and it couldn't possibly be that. And so that's something to really bear in mind. Also bear in mind that the medicines and the activities and those things that your doctor tells you to help prevent, what we call primary prevention, okay, you haven't had an event, those are as applicable in a woman as they are in a man. Those are the kind of things where you remain active. You take your medicine for your cholesterol. If you're starting to show evidence of diabetes, it's really important. Be aware of the fact that mortality for women when they present with something as simple as an impaired glucose tolerance or pre-diabetes is threefold that of the male counterpart in the same situation. So we just don't do as well. A lot of that used to be attributed to the fact that we were older when we presented with our issues, but that's not the case anymore. And going back to primary prevention, I think one of the big things in this last year that's been something that they've talked a lot about is where's aspirin fit in primary prevention? The current consensus is that it's a balancing act. If you have a 10-year risk of greater than 10%, which we consider a high risk, even if you haven't had a vascular issue, you are someone that, as long as your bleeding risk is minimal, should probably be taking an aspirin. Wow. For patients over the age of 75, the data is much less strong in terms of primary prevention with aspirin because the bleeding risk begins to accelerate at that point. So that's something to bear in mind. So how do you determine what your risk factors are? Number one, your risk goes up with age. Number two, your risk goes up. Men have a more prevalence of coronary disease in the greater than 55-year group. For women, it's more than 65 years of age. What's your race? African Americans oftentimes will have an increased risk of vascular problems. And when we talk about vascular, we're not just talking about a heart, we're talking about stroke and peripheral vascular disease. Other issues are what's your cholesterol. You should know what your cholesterol is. You should know what your good cholesterol is. You should also know, do you have a history of high blood pressure? What about your history of any problems with exercise intolerance? Some of the risk factors which women have that men do not have are interesting. One of them is that if you had presented with blood pressure or sugar problems during a pregnancy, your risk of having those disease process, which puts you at risk for additional vascular problems, increases tremendously. Within the next 10 to 12 years after that pregnancy, you will likely have high blood pressure and diabetes. So in that interval, paying attention to how you eat, what you do, those are the things that might prevent you from falling into that group. An interesting and very unique risk factor for women is if you don't lose all the baby weight in the first year.
Wow.
How about that?
Yeah.
15 years, you're going to be obese. How about that?
Wow.
And again, a normal pregnancy gains about 20% of body weight. So that's a lot to come back off again, but that's an interesting one, I thought,
Especially
to be honest with you.
That is hard to do.
It sure is.
You know, when
sure
you
is.
have kids and then you
And
slow down and
yes.
the snacks are easily available. So.
Especially now when we're all staying at home,
Yes.
you know, that's really something.
Yes.
Some other interesting thing, of course, is autoimmune disease, and that really applies across the board, although women tend to have more episodes or more problems with autoimmune disease, specifically rheumatoid arthritis, which is 2.5 to 1 times more frequent in women, and lupus, which is 9 to 1 more frequent in women. And those are associated with an increased risk of vascular problems. So those are kind of unique and things we should be aware of. And again, going back to the concept of prevention being the best motive or the best way to handle what's going on with the patient. So some additional things that are unique to women is that your risk of cardiovascular disease increases with preterm delivery as well.
Wow.
The other thing is a unique risk factor, maybe not completely for women because men get it too, is breast cancer treatment. Women who've had radiation over the left breast area will have an increased risk of proximal coronary disease, proximal vessel coronary disease, but also those patients that receive chemotherapy for their breast cancer. We've made some great progress for that. And again, it doesn't exclusively apply to women, it's anyone that receives those things, but they are an increased risk for premature vascular disease. And interestingly enough, depression, one of the other things that affects across the board, not just women, but also men. And that also is considered a risk factor for vascular disease. So there's a lot that's out there. And of course, a lot since we've been stuck at home that may be being precipitated. And also, those are the kind of things in terms of depression and weight control and snacks and all those. That's where the exercise at home, be creative, you know, lift cans of peas, whatever. You don't have to go to the gym.
Workouts on YouTube.
yes, anything, whatever suits you. And find something you can do that fits into your schedule. Because if it's something that requires a great deal of you to do and you know you've got to rearrange stuff and there's kids you got to take care of, you're not going to do it. Okay,
you easily talk yourself out of it, don't you?
It's very easy. Yeah, it really is. I mean, and that people laugh at me because I've worked out for 30 years in the morning, but it's because I had children, because I had to get it all done before they started their day.
Well,
so,
good for you.
So,
Good for you. Well, very, very interesting. North Alabama Medical Center is an accredited chest pain center, and we have a cath lab team available 24/7, 365.
That's right. And we're here to serve. And remember, the sooner you get here, the sooner we can help and the less long-term ramifications you will have. And that's really what this is all about.
Very good. Thank you so much. If you are looking for a cardiologist, you can visit our website, namccares.com/findaphysician.